Neurohacking is the practice of using technology to measure, monitor, and influence the brain's activity to achieve self-regulation, thereby promoting mental and physical health without relying primarily on medication. The common thread running through technologies like biofeedback, neurofeedback, and virtual reality (VR) therapy is the concept of operant conditioning. Operant conditioning is a learning process where behavior is modified by its consequences. In the context of neurohacking, measurement, a sensor, e.g. EEG heart rate monitor, measures a specific physiological or neural process, the behavior. Feedback. The technology instantly translates this measurement into an accessible and often engaging signal, e.g. a sound, a graphic, a video game score. Reinforcement. The patient is instructed to subtly shift their internal state, e.g. relax, focus, to make the feedback signal desirable, e.g. the tone gets lower, the game character moves forward. The desirable feedback acts as the reinforcer. Learning. Over repeated sessions, the brain learns which internal state produces the desired result, effectively gaining conscious or unconscious control over a process previously considered involuntary. The technology provides the mirror the brain needs to see and correct its own function. Technology spotlight and case studies. One neurofeedback for ADHD and focus. Technology, neurofeedback, a specific type of biofeedback, uses an electroencephalogram, EEG, to measure brainwave activity in real time. Electrodes are placed on the scalp to detect electrical signals associated with different brain states, e.g., theta waves for drowsiness, beta waves for focused concentration. Case study, enhancing attention in a student. Patient profile, an 11-year-old student diagnosed with attention deficit hyperactivity disorder, ADHD, who struggles to maintain focus in class and complete homework. Intervention. The student plays a simple video game controlled entirely by their brainwaves. They are trained to increase the sensorimotor rhythm SMR or beta waves associated with calm, focused attention, and decrease theta waves associated with inattention, daydreaming. When the focus waves are high, a rocket ship takes off on the screen, positive reinforcement. When inattention creeps in, the rocket slows down. Outcome. After a course of sessions, the student's brain is naturally conditioned to produce more focused wave patterns. The result is often a measurable reduction in inattentive and hyperactive symptoms, with improvements in academic performance and a lessened reliance on stimulant medication. 2. Virtual reality VR for pain management. Technology. Virtual reality VR is used as a powerful distraction and conditioning tool. By immersing the patient in a compelling interactive 3D environment, it engages the sensory and cognitive centers of the brain responsible for processing incoming pain signals. Case study, reducing acute burn pain. Patient profile, a patient undergoing painful debridement cleaning of severe burn wounds. Intervention. During the painful procedure, the patient wears a VR headset and is immersed in a freezing, snowy world called Snow World. This highly engaging environment requires intense focus, e.g., throwing snowballs, navigating icy canyons. The visual and cognitive load of the VR experience heavily recruits the brain's limited attentional resources, which are also needed to process pain. Outcome. Multiple studies have shown that patients report significantly lower pain scores when using VR therapy compared to traditional analgesic medication alone. The VR experience essentially hacks the attention network, closing the gate to pain signals by overwhelming the brain with competing sensory information and giving the patient a sense of environmental control, which lowers anxiety and consequently pain perception. Conclusion. The dawn of self-regulation. The series on neurohacking has shown that the brain is not a static, fixed entity, but a highly adaptive organ that can be trained and conditioned for optimal function. Technologies like biofeedback, neurofeedback, and VR are providing us with a powerful, non-invasive toolkit to achieve radical self-regulation. By providing the brain with a real-time mirror of its own activity and using the simple, elegant power of operant conditioning, these tools empower patients to move from being passive recipients of treatment to active architects of their own healing. This shift represents a revolutionary future for personalized medicine, where the focus moves beyond just treating symptoms to training the underlying biological systems for lasting well-being. And with that, we conclude our deep dive into the world of neurohacking. Thank you for joining me on this journey, exploring how technology is fundamentally changing our understanding of and ability to influence the human mind. And with that, we conclude our deep dive into the fascinating world of neurohacking. Thank you for joining me on this journey exploring how technology is fundamentally changing our understanding of and ability to influence the human mind. Join us next time while we pivot to our new series, The Human Connection.